In today's medical moment, when wounds won't heal on their own, the experts at the U of M Health West Wound Healing Center can provide a personalized therapy program using advanced therapies to help move you towards healing. Joining us this morning to share more about the center, registered nurse Loreine Landoy. Good morning, Loreine.
Good to be here, Todd.
Thank you for being here and talking more about this. This is something that not a lot of people know about, I think, or even talk about, the Wound Healing Center. Talk about first what you do specifically, and then how it's a holistic approach with many, well, you got doctors, nurses, such as yourself, technicians, assistants, all that.
Yeah, well, what we do is take wounds that are problematic to heal. We call them chronic wounds.
Okay.
Essentially, after a month or so of non-healing, wounds are considered chronic, usually with some underlying issues affecting why it won't heal. Mm-hmm. So what we do is we take evidence-based practice on wound care, and we apply that individually to each of our patients as they come. Because they're all different, but so we like to apply those practices as they come.
What do you see the most common? What would cause a wound not to heal?
Well, a lot of wounds will depend on how chronic a person's condition is. A lot of the wounds we see are diabetic foot ulcers, okay. Because of the nature of diabetes. And a lot of vein issues, or venous leg ulcers, as we call them.
Okay, so vein issues. Is gangrene in there at all, or I mean, there's a point that people come in with gangrene. We don't recommend waiting that long for them to come in. If they see their primary care doctor as soon as they feel like there's an issue, and request a referral to us, we could get the process started rolling. We like to save limbs and life at the same time, because things can progress and they can get quite serious. Yeah, I mean, this could cost someone their life. So limbs and life, I like that. You save them both. And when it comes down to, I mentioned the holistic approach. Talk about the team and how they all work together.
Yeah, we have a team of providers. We have general surgeons, podiatrists, our RNs, and our medical assistants and PCAs. So we work together basically to provide the care that each patient needs. So we communicate, and each and every one of us bring in our extra layer of expertise when it comes to providing patient care.
And how do you provide that care? What type of therapies are we using?
We do a whole plethora of therapies. We perform wound debridements during their visits. Mm-hmm. We have advanced dressings that not a lot of people have access to. We have technologies such as hyperbaric oxygen chambers, and we use skin substitutes and such technologies that essentially you won't see in a regular doctor's office.
I'm pretty sure you just said something I want to hear more about. Skin substitutes?
Yep. So if a wound becomes too problematic, we either like to apply like advanced skin substitutes. Essentially, it provides your body with components of good skin, which can help with the healing process in itself. So there's a lot of them. Each of them does something different, but we have access to those technology at the wound center.
And obviously, the end goal here is just to have the wound heal. I mean, that's it.
Yeah. And above that, the wound to heal, and we like to make sure we provide a patient with the ability to prevent further wounds. We'd also like to work with other departments to make sure that we also help the patient just be live healthier.
Yeah, absolutely. That's what we're all looking for. Now, if someone's watching this right now, maybe someone with diabetes or someone who may be suffering, why isn't this wound on my foot healing? Where can they find the Wound Healing Center and get more information?
Yeah, so the Wound Healing Center is attached to the main hospital, the University of Michigan Health West. over in Wyoming. It is in our professional building, and they could give us a call, or much preferably, they see their primary care and request for a referral.
So start there.
Yeah.
Yeah, start with your primary, get a referral if needed, and you'll get all hooked up with some of the most advanced therapies waiting for you right here in West Michigan at the U of M Health West Wound Healing Center. The phone number right there on your screen, 616-252-7494. Or you can always go to uofmhealthwest.org for more info. We'll be right back.